Hello, my name is Dr. Edward Forsthoffer, and I am the Superintendent of the Hillsborough School District. This brief audiovisual presentation is intended to update our community on our preparedness for the H1N1 flu virus. As you know, the Hillsborough community, like most others, was affected by the H1N1 virus as we prepared to close schools last year. Since that time, we have been preparing for the opening of schools for students on September 8, as well as preparing for the predicted resurgence of the flu virus. At this time, there is no clear indication that the H1N1 virus will present itself the way it did a few months ago, or with less or more severity. The Center for Disease Control and Prevention, or CDC, has been preparing for the fall-winter season, and we will follow the guidelines established by the CDC. Over the summer months, I attended 2 summits related to the H1N1 virus. The first summit involved health officials and district administrators in Somerset County. The second summit was held at the South Brunswick High School and involved professionals from throughout the state. We are working closely with the township, the county, the state, and the country to best prepare for any potential pandemic. There have been a few changes to the guidelines since last spring, so I would like to take a few minutes to update you. Before I begin, one of the recommendations is to be very careful in making the decision to close schools. This is really a last-ditch scenario, and schools will only close if we are unable to continue to hold instruction. This could be due either to a very high student or staff absenteeism. Since I agree with the CDC and would prefer not to close schools, I want to review some preventative guidelines related to staying healthy. First and foremost, if you are sick, do not come to school. In fact, aside from the possibility of visiting a doctor, you should not leave your house. Unlike in the spring, a student can return to school after he or she has been fever-free for at least 24 hours without taking any fever-reducing medications. If your child is on medication, even antiviral, to treat the flu or fever, he or she may not return to school until 24 hours have elapsed with no signs of a fever. If a student or staff member becomes ill in the school, we will make every effort to separate that person from the rest of the population. Our facilities are not large, and that is one more reason to make sure that ill students remain home. However, occasionally a student will become ill during the school day. In that case, every effort will be made to isolate that student from other students. While students are in school, there are measures that we will take and will ask the students to take while in our buildings. It is important that students are not seated too closely together. This means that, where possible, student desks will be separated and classes will more than likely be set up in rows instead of clusters. Hand hygiene is even more important than ever during this time. The CDC recommends washing hands with soap and water. Some hand sanitizer will be available, but this does not clean dirty hands. Hand sanitizer will assist in killing germs, but it is important to keep hands clean. Another recommendation from the CDC has to do with coughing and sneezing. Since it is true that a person could have the virus and not yet show symptoms, it is important that we take precautions so that the virus is not spread accidentally. When sneezing or coughing, it is important to cover your mouth with a tissue or to cough or sneeze into your elbow as opposed to your hands. Of course, we will be stepping up the cleaning regimen in our schools. Particular attention will need to be paid to high-use areas of the building. Keyboards and doorknobs will be cleaned nightly. It should be noted that the CDC does not recommend any special cleaning products. However, we feel that paying attention to high-traffic areas will assist in decreasing the spread of the virus. The government is currently completing test trials on a vaccine for the H1N1 virus. The earliest predicted availability and dissemination of the vaccine is mid to late October. Since the vaccine will be rolled out based on availability, people have been placed into groups based on need. The first group to receive the vaccine would be children aged 6 months and below and expectant mothers. Additionally, because the vaccine is being rolled out over a period of time, it is possible that some may not receive it until December. It should be noted that the regular seasonal flu vaccine is now available, and although this will not prevent against the H1N1 virus, the CDC is recommending that if your physician recommends it, students should receive that vaccine. Please contact your personal healthcare provider if you wish to receive the seasonal vaccine. It is important to note that receiving either the regular flu vaccine or the H1N1 vaccine is completely voluntary. Current CDC guidelines do not make receiving the vaccines a requirement to stay in school. The Hillsborough School District will continue to work with all departments to make sure that current information is being provided. Hillsborough Township recently conducted and tested a point of distribution drill in the event that information or materials need to be disseminated. We are in contact with the county and the state to stay abreast of the most current information. And also, as new information develops and guidelines from the CDC change, we will communicate major changes as soon as they are available. In summary, at this point in time, no one can predict how the H1N1 virus will develop and how much of a factor it will be. We are planning for events similar to last spring, or possibly worse, while hoping that our planning will go unutilized. As a reminder, it is most important that students not attend school while they are ill and not return until they have gone 24 hours without fever or flu-like symptoms and are not taking any fever-reducing medications. All students and staff need to be vigilant in covering their mouths while coughing or sneezing and must keep their hands clean. The CDC recommends clean hands with soap and water or an alcohol-based hand rub often and especially after using tissues and after coughing or sneezing into hands. The school district will have some hand sanitizer available. However, I am recommending that any parent who would like their child to use hand sanitizer, please send it in with your child. Also, if you prefer that your child not use the hand sanitizer, please have this discussion with your child prior to the start of school. We will keep you updated as much as possible. The good news is that the virus did not mutate and become stronger in the southern hemisphere, where the winter is now ending. Hopefully, we will avoid an outbreak similar to what we experienced in May and June. However, we are prepared in the event another wave does come. Thank you very much for watching and listening to this presentation. Additional information can be found at the following federal, state, and local websites and telephone numbers.